It's budget season, and today, both the governor and the mayor of San Diego unveiled revised spending plans. Thank you for joining us. I'm Maya Trabulsi, and we begin at the state level. California has the fourth largest economy in the world, but it also has a $12 billion deficit to close. KPBS reporter Tanya Thorne says Governor Gavin Newsom's May revise comes with controversial cuts.
Facing a budget deficit and potential funding cuts from the federal government, Governor Gavin Newsom is having to make some cuts to California's budget.
We will be tasked with making decisions in a very challenging and vexing time, perhaps the most challenging and vexing we've had in some time.
To help close the gap, Newsom is freezing new Medi-Cal enrollments for those who are in the U.S. without legal status. California was one of the first states to extend free health care benefits to all low-income adults, regardless of their immigration status. But the program ended up costing almost $3 billion more than expected.
I warned the governor a year and a half, 2 years ago, that this program, the Medi-Cal program in California, was unsustainable and that he needed to start taking a serious look at that and making the cuts back then to prevent us from being in the deficit situation that we are now.
Senate Minority Leader Brian Jones of San Diego says Newsom is now having to break promises he should have never made. True Care, a community health center, says these cuts could have ripple effects in people's health and emergency rooms.
So it's really gonna make the community sicker because if people don't have coverage, they're not going to do the preventative care. They're not going to make time to come in and get seen when they really should be. And then that just multiplies. People get sicker. They end up in the emergency room. Or, sadly, oftentimes they die sooner from diseases that could be taken care of if they came in to be seen.
Anthony White with True Care says the cuts could also disrupt the finances of community clinics that often operate on a sliding scale system for patients. The same services may not be offered in the future. California's school systems got some relief from the cuts. Newsom's proposing a 3% cut to the California State University system, compared to the 7.9% cut proposed in January. For public schools, the budget continued support for several programs.
There's a lot of strong things in there. Transitional kindergarten, we've been a leader in that, and you saw that continue to be supported in the budget. Universal meals, free breakfast and lunch for every student is still supported in the budget. Expanded learning opportunities, that time outside of the school day, before school, after school, summer school.
The budget revision moves on to the legislature. The final budget has to be approved in June. Tanya Thorne, KPBS News.